Alrighty, thank you for joining us today. My name's Chris. I'm a marketing and communications project lead here at Synapse. And this week we're celebrating Brain Injury Awareness Week, where we're focusing on how every brain injury is different. And that's from how somebody would acquire their brain injury, their experiences of recovery, through to the long-term effects of brain injury on their lives. Today, I'm happy to be joined by Professor Beth Armstrong and Kerri Colegate, and we're going to be talking a little bit about communication problems that happen after brain injury, people's experiences of that, and particularly the experiences of Indigenous Australians around this area. So thanks for joining us, both of you.
Thanks, Chris.
So we might start by learning a little bit about the both of you. So Beth, if you could start by giving us a bit of a background on yourself, your career, and what you're working on at the moment.
Okay, thanks, Chris. I'm Professor of Speech Pathology at Edith Cowan University in Perth. I've had a long clinical background as a speech pathologist working in hospitals with people with brain injury in Sydney, then moved to Perth about 12 years ago and worked at Edith Cowan University. So I've always been interested in how the brain works and in language and all the different things that can happen after brain damage and working with people after stroke and traumatic brain injury. And in the last 10 or 15 years, I've been working more with Aboriginal communities and working out how brain injury and services are offered to Aboriginal Australians and their perspectives on the recovery from brain injury and services available.
Yeah, that's great. And Kerri, how about you?
Yep, so I'm a Noongar woman living in Armidale, the suburb of Armidale in Perth. I've always worked in the health industry in a number of different roles, from projects, small to medium projects, management, a little bit involved in some research projects. Probably in the past 12 months, I reached out on my own, branched out on my own and started my own consultancy. And that's probably a little bit more down the track of the NDIS sector. So I do quite a bit in that field, supporting Aboriginal people with all different abilities, as well as doing some other cultural consultancy work in a health-related way as well.
That's great. Thanks, Kerri. So I thought we'd kick off and just learn a little bit more. So you've both done a lot of work in understanding brain injury and how that affects people, and particularly around communication problems. And I guess perhaps, Beth, we could start with you as far as what raised your interest in looking at this in the context of how it impacts Aboriginal Australians.
Okay, so as a speech pathologist, I started with an interest in communication problems and speech problems and language problems that can happen when the language areas of the brain are affected after a stroke or a traumatic brain injury after an accident or a fall. And so, as I said, I've always been interested in language, the effects of both communication and broader brain injury on people. And I became very aware that as a speech pathologist, there were very few Aboriginal people on speech pathology caseloads, even though that we know that stroke and traumatic brain injury occur quite frequently in Aboriginal communities. So from a research perspective, I was interested in finding out why that was. And so the people that could tell us why were predominantly the Aboriginal people with brain injury. So we started a large project called Missing Voices. And that was a project where we went around the state asking Aboriginal people and their families who'd experienced brain injury what their experiences were like of brain injury and communication problems and other difficulties that happen after brain injury, and what their experiences of services were like. And also, given that the majority of Aboriginal people after brain injury, who have brain injuries, live in rural and remote areas. Not all of them, but many people live in rural and remote areas where rehabilitation services are not too thick on the ground. So, you know, there were lots of issues that came up.
And Kerri, how did you sort of get involved in all of this?
Given that, you know, I've worked in a number of health-related roles, including, you know, parts of disability, I knew that there was sort of a gap there out there in the community, particularly with my experience in my past job of working at an acute hospital. So the number of Aboriginal people that you would see coming through, I guess, through admission or through ED presentations that sort of had you know, fitted this particular sort of research, you know, it was sort of known that there was a lack of support, I think, ongoing to support Aboriginal people around their conditions, in particular, sort of to support that information around learning a little bit more about what's going on, and just to sort of come together and connect culturally as well, just as importantly to support that well-being.
Yeah, that's great. Thanks. So I thought we'd take it back to a little bit of the basics as far as communication problems go, and perhaps you could explain some of the common communication problems that people experience after a brain injury, and the types of ways that those things are generally treated.
Okay, so after a brain injury, you know, the theme for Brain Awareness Week is the different brains, and people can have very different kinds of communication difficulties and other difficulties after brain injury. So from communication point of view, it can vary from having slurred speech where the muscles of your mouth are actually affected, to the condition called aphasia. And aphasia is where your words and your ability to create sentences and remember names of things and have conversations with people are affected. And the severity can differ. You can have a very mild communication problem where you can still talk, but you may forget the words occasionally, or you may slur your words, to a severe condition where you can't speak at all. And you need to convey either through hand gestures or facial expression or other ways of communicating. So there are various parts of the brain that are affected, and they can all result in different kinds of communication problems. And I guess one of the things with communication problems after brain injury is that they're often invisible. So when someone has a stroke and can't walk or is in a wheelchair or can't move their arm, everyone can see that. Whereas if it's you're talking on your communication, people don't know till you open your mouth or that you can't reply to them. And oftentimes people misunderstand that. They think that people can't think in the same way, or that they've got a mental health problem. But it's actually not that. It's just a particular area of the brain that's affected, that's going to affect their communication.
And you've had a lot of experience and done a lot of work around treatment approaches for some of these problems. What specifically have you sort of learnt in that space, you know, from an academic perspective, and then perhaps Kerri, maybe what you've experienced seeing treatment more in a cultural context?
From a treatment perspective, I guess one of the things that I've learned over the years, and that certainly researchers have learned more, focused on more recently, are the effects of the communication problems on people's lives. So originally treatment was very focused on reteaching people words, reteaching people how to create sentences again, reading, writing are all involved in language. So oftentimes therapy would occur in an office at a hospital, or you know, a place that was very different from someone's home. In more recent years, treatment has focused more on what people are interested in terms of their needs, their communication needs. So they might want to talk to their grandchildren more, talk to the grannies, and be able to tell stories that they want to talk, and that would be a priority to them, for them. They might want to talk at work more, you know, have specific needs at work that involve language. They might want to go to family outings more, or go to a party, or you know, go to a barbecue and talk to people, or sit around a fire and tell stories. So there are a lot of different situations that people want to be able to talk in. And so as speech pathologists especially, and rehab specialists, we're more interested now in finding out from the person and making the therapy relevant to them, and helping them refine words and ways of talking that will help them adjust to and get back to as many things as possible that can make them feel like they were before, although sometimes that's not possible, but can get them back into their family space and their social space, because some of the issues with brain injury can lead to isolation from family and friends, to depression, and sometimes can have a greater effect on people than even physical problems after brain injury. So we're doing a lot of research more into the effects of communication on people socially and personally and in their community. And also, I guess one more thing I'll just say that we have learned is that the more you talk after these events, the better. So neurologically, we're learning a lot about the brain mending itself. And once, if you'd had a stroke or brain injury, people would say, well, there's nothing much we can do. But now we know that the brain keeps mending itself, but you have to help it by practicing. So we tell the people, use it or lose it. The more you talk, the more you're going to get a good recovery. So don't try not to isolate yourself. Try not to sit in a back room by yourself. Keep talking, keep doing things as much as you can, and that will actually help yourself as well.
And Kerri, I guess from your perspective here, I guess looking at that treatment and how that plays out and how that can be done in a way that's relevant in a cultural context.
Yeah, look, Beth's pretty much touched on it all, and I think it's just about being a little bit more flexible, in particular with my current experience working with some of the NDIS participants. It's about sort of taking the therapy to the family and meeting people in their own reality. And by that I mean, you know, it's not always meaning going into their home. Some people might like that. There's a lot of people that don't like that either. But it's just about finding out from the family where they would like to sort of undertake that whole approach. You know, because I think it also then gives a really good idea and for the therapist to see people in their own world and how things, you know, are at that given time. And I think then it's better supported in that, within that cultural context, to consider what's going on culturally and to see how that can be sort of integrated into the two as well. So just being sort of open and flexible and really sort of working out with the family at first, you know, what's best for them and what approach would they like to take at the onset of all their therapy.
And also, I'll just add too, and Kerri, you might like to add on a bit more about the role of an Aboriginal liaison officer or a therapist. As therapists and rehab specialists, we're looking, as a non-Aboriginal person, it's great, we're getting more and more Aboriginal speech pathologists and health professionals, but very often the person working with the Aboriginal patient is not Aboriginal. And we really, as non-Aboriginal health professionals, are looking more to learn more about how to do things in a culturally safe way. And that often means working with an Aboriginal liaison officer or family or another Aboriginal person to make the treatment, as Kerri said, a little bit more real and relevant for the person.
Really, really important. I think it's getting better. It has, you know, I have noticed a lot of changes over the year. You do hear a lot more positive feedback from community in relation to, you know, how things have sort of changed in the sense of people being a lot more culturally responsive to cultural needs, and really just as importantly, just sitting and listening and watching, and not just making those assumptions that it's okay to do a practice in a way that people are supposed to know or people are meant to sort of adapt to. It's really about finding that two-way approach and making it really work well for everyone to get those positive outcomes, both clinically and culturally.
So Beth, you've got a couple of key projects happening at the moment in this realm. Did you want to speak a little bit more about what those are and what's being done there?
Sure, yes. The first project that came out of, both projects have come out of the long-term consultation and talking to Aboriginal people with brain injury and their families, as well as health professionals. So one of the things that was very obvious that came out of our conversations with people were that people really want services and they want help and they want treatment, Aboriginal people with brain injury. And then the difficulties that they face, often in rural and remote communities, are really important to take into account, and how we provide services not only to the general population in rural and remote areas, but to Aboriginal people and families who may have difficulties staying in contact with the rehabilitation services for a variety of reasons. And even living in rural areas and remote areas, how they could access some of those services. And of course, telehealth is now an option for people. And so more information on telehealth, and particularly when people are leaving hospital. One of the issues that came up is about communication. And communication is a big issue in Aboriginal health and for the hospital system, in ensuring that when Aboriginal people leave hospital, as with all people, we want people to know what options are available to them. And this is constant feedback that there are still breakdowns in communication, often for cultural reasons. And so we need to be aware that from the hospital perspective, that people need to be clear, that information needs to be written in a way that is understandable to people and that's practical to them. And also keeping in mind that people are often in acute hospitals in the city environment, in metro hospitals, and they're discharged to rural environments where a lot of the health professionals in the cities aren't that aware of what actually is available in rural and remote areas. So there's still a bit of work to be done in joining up the services. And so better communication between the metropolitan areas and the rural and remote areas, but also even within all the hospitals, there's a lot of work being done on cultural security training, cultural security workshops that are available. I'd really encourage health professionals to look to any cultural training they can do, and certainly the people that we've spoken to in our projects have said they want more of that. So that was a big preamble to our projects, but all of our projects come out of discussion with not only the people with brain injury, but also health professionals. So we have two projects going, one that we're into the last 12 months of called Healing Right Way. And that was dealing with the recommendations of people who wanted better support after leaving hospital. So we've employed a new role called an Aboriginal Brain Injury Coordinator, and that person is Aboriginal. They are currently from nursing or enrolled nursing backgrounds. They go into the hospital, meet the person and their family when they first have the brain injury, and then they follow them up and support them to stay in touch with services and sort of navigate the health system, which can be quite difficult. So that's one part of the project. And the other part is with the cultural security workshops in the hospitals that we've been doing for the last 3 years. Skilling up staff in ways to approach Aboriginal patients with brain injury in more culturally secure ways. The other project that Kerri actually is the manager of is called brain injury yarning circles. And these are support groups in the community. We're starting one here in Perth and one in Geraldton for Aboriginal people with brain injury, not only communication problems, but with brain injury that they may have other kinds of impairments, physical or cognitive behavioural issues. And we're currently starting those. So people are very interested in getting support, again, though, from other Aboriginal people, which is really important at this particular point in time.
Yeah, absolutely. Definitely. Well, those projects sound amazing, and definitely sort of heading in the right direction to ensure people get the kind of support that really works for them on an individual level. That's great to hear. So I thought, Beth, we might finish up by looking at going over a few key takeaways from your years of experience that might help, say, health professionals, allied health workers, to, first of all, better understand some of these communication problems that a lot of people have after a brain injury. And then, from your projects, what you've learned about how those same professionals and workers can be more aware of the cultural context and things that are important for Aboriginal and Torres Strait Islander and other Indigenous peoples in Australia.
They're very big questions. I guess the first thing with communication problems is just reiterating the point that sometimes communication problems can be hidden, can not be prioritized as having the impact that they actually do. So communication is all encompassing in our lives. If we think of what we do every day, whether it's talking to people, texting, talking on the phone, Zooming like this, if your communication is affected in any way, it's going to affect your whole life. It's going to affect your relationships, your work environment, your family. And so I guess the first thing is for people to acknowledge the importance of communication disorders and the impact it can have. I guess for health professionals too, we have a lot of knowledge around communication disorders, and speech pathologists are really sharing that. And I think the multidisciplinary approach in rehabilitation is a great way forward. And I think a lot of health professionals are becoming more aware of working in a multidisciplinary way, in a holistic way, is the best way to approach assisting people after brain injury. And that very much also fits in with an Aboriginal model of health, which is holistic. It's very difficult working on one particular aspect of a person after a stroke. So while we all have our different roles in different disciplines, we actually have to work together because the human body works as one. It doesn't work as a mouth or a leg or an arm. So I guess working together is key message, and understanding that the person themselves also doesn't divide themselves up into different areas. They're a whole person, and if we look at assisting the person, we have to work as a team and we have to work holistically. That brings in client-centred care, which is a big message that I think all health professionals are trying to achieve, and it's also very important in the cultural space. We come in with theoretical knowledge, we come in with ways of doing things that have to be modified depending on the context of the person we're working with. And that speaks again to the diversity issue, and that brains are not the same and people are not the same. And certainly from an Aboriginal perspective, Aboriginal people, the community will tell you how diverse that is as well. So when people often ask our team, how do we work with Aboriginal people? Our first response is, there's no one toolkit. This is a diverse group of people. There are no magic formulas. There are no recipes in ways of doing things culturally safe. But in terms of generally speaking in rehab, we're looking at culturally, client-centred care. We're looking at people holistically. And we're looking to make our treatments relevant to people and to communicate our knowledge and information in a two-way manner so that we fit in and we can fit our information and convey it in a way that makes sense to people. I often hear of health professionals conveying information and trying to convince people why to have rehab, for example, or why doing home practice is important, or why doing what their goals might be. And a lot of goals are done jointly, but sometimes we still drive that goal setting process, even though we're trying to be more client-centered. So I don't think, I think we need to just keep on trying to be more and more client-centered, more and more relevant, more and more meaningful, and get our messages out there in a two-way fashion so that we're not talking at people, that we're actually having real life conversations. And I've learned a lot through working with Aboriginal health professionals and Aboriginal community in general. And one of the things that we're working on in our yarning circles and also in our cultural training with health professionals is called clinical yarning. And it's really a two-way form of conversation. And it's hard for health professionals to get into that manner of really having a two-way conversation with their patients and their clients and finding out about them more. We all try to do that, but certainly in the cross-cultural space, it's just crucial. And you're not going to get anywhere unless you really understand the person's context. So you can try and convince people of all the right things to do, but if it's not relevant in their particular context, it's not going to be meaningful to them. So from a cultural perspective, it's working with cultural brokers. In the case of Aboriginal people, it's working with an Aboriginal co-worker, a collaborator, finding your local Aboriginal liaison officer in hospitals. But it works cross-culturally across all cultures. And so there are many principles that go across clinical practice that can be learned through focusing on cross-cultural practice. And as I said, I've learned a lot through working with Aboriginal colleagues and Aboriginal clients and research participants. And I think a lot of those learnings, hopefully we can put back into general rehabilitation practice. I think they're all coming together, and a lot of great things are happening. And there's a lot of awareness and a lot of goodwill for improving services for people cross-culturally generally. But we've still got a long way to go with our First Nations peoples. But there's also a lot to learn from them.
Yeah, that's fantastic. Thank you so much, Beth. I think what's really great there is, we're looking this week at how every brain injury is different. But what you're saying here about every person and every individual is different as far as their culture, what's important to them, what they might be looking to get out of their rehabilitation. So, there's very many layers here. And I think to have that holistic approach to care and rehab and treatment really is, fantastic way to move forward. We're not trying to develop, a blanket approach here, but rather looking at, each person's journey and what's meaningful to them and how they can be best supported. So, thank you so much for joining us today. We really appreciate your time.
Thanks, Chris. That was a great summary, and I really appreciate the opportunity. Thank you.
No worries. Thanks so much.